Heguinut Besede wasit when the Mudagaji, I know I'm going home now. They see now, Jawan, was it out of say, I know him that. Respect to other way, Hegwaji, what did you know? I'm home at Bish. Okay, we had a few requests to translate ourselves in English to what we were talking about with the virus going around. So I'm going to try my best to speak about what I spoke about earlier. But if you got more concerns with the medical issues, nurse questions or doctor questions, there's a Facebook on site, Karen Williams. She's on site there, and she can answer questions as much as she can on that site. So first of all, I'll start off. This is Chief Hart from Sheshatshiu First Nation, and I'm assisting with Mary Pia Benuen, our nurse through public health. So we're talking about the virus that's going around, not only around here but all over the world. I guess I'm sure you're all aware what kind of virus is going around. It's going around everywhere, and it's not slowing down. So we're just giving out information for the people to be precautionary what we're doing in our town, what we're meeting with the leaders amongst ourselves and the public health and Mary May Healing Center. And the important part is the nurses to contact us directly as leaders if anything comes up. So what we're talking about is limiting people going to Goose Bay and not going up with children if not necessary. If they don't have to go to emergency, leave your kids home just to be caution, and limit yourselves in the vehicle if you're going to Goose Bay, or don't go to Goose Bay if you don't have a reason to go to Goose Bay. This is the whole point. We're trying to make sure everybody gets the message, and messages are going across Canada and the States. It's not only us as Sheshatshiu that's being precautioned. It's everybody on the reserves across Canada, Quebec, wherever. They're the same way. They're doing preparation for their own community. So for our own safety, we spoke about it as leadership today, that we won't be allowing. Monday, the road will be gated, both sides. The intersection coming up the hill here towards where the Muskrat Falls bus parks. That road there will be gated off on top, and the road on the clinic will be gated off as well. There will be security there measured there Monday. We're going to knock down the people that's asking the people to not go to Goose Bay if it's not necessary. So Monday will be the setup. Tuesday will be very limited. Don't bring children to Goose Bay with you. If they don't have to go to the emergency, if it's just for a joyride, we rather for them to be left at home with other family members. And for people to try to stay home. This is very important for everybody to stay home, because it's not us that's making the rules. It's what's coming around the world, even the politicians in Ottawa and the States. And everyone's just like, we're declared a shutdown. And we got to follow the procedures, what we're asked to do as well, because we can't just not do anything about it. So Monday is going to be, the gate will be set up in both intersections. Tuesday is going to be very limited of how many people can go to Goose Bay in a vehicle. And Wednesday is basically going to be the shutdown. You can't leave until you're actually going to an emergency, or you ran out of your prescription or groceries. And I'm hoping I'm clear here what I'm saying. And also, we're just warning the public, like everybody, just to stay home with your family and your loved ones. You don't have to be anywhere that you don't have to be at the same time. But it's just important for everybody to stay home. That's what everybody's asked to do. Is if you don't have to go out for anything, stay home. So, and the other people were asking about outposts. So we are as leaders looking into the outposts for what the Canadian helicopters are going to come back to us tomorrow to talk about the procedures and everything. We just got to be cautious because we don't want to send anybody out in the country and then we can't go pick them up. But we want to know answers before we can start anything. There has been a emergency trust proposal submitted to the trust, and I think they're meeting tomorrow regarding the outposts. And people's allowed to go up on the road. That's their own choice, because a lot of people are camping on the road or up the road further just to isolate themselves with their own children and siblings. And I think that's a good idea too. And they're not in a big crowd. So I think everyone should just be cautioned. And I'll let Mary Pia, the nurse, do her speech as well, because she has more information than I do. But I'd like to thank everybody that's listening to the radio. And we're just hoping for everybody to cooperate in the community. It's not that we're saying nobody's allowed in town. It's just that if you're living in town, if you're non-native as well, it's not like you're not going to be allowed back in. You're going to be allowed back in. Just let the person know where your address is, and you'll be fine. Okay? Thank you.
Okay, good evening, people. This is Mary Pia Benuen, and I work at the Maniashni Health Center here in Sheshatshiu, and I work as a director for the primary health services, and I'm also a public health nurse there. There's a few things we'd like to there are a few things we'd like to send a message to our community members. I know not very many people, I know we have a lot of people, non-Innu people living in our community, and we'd like to share this information to them too, as they are residents of our community. Anyway, we all know that the coronavirus is fast spreading, and it is not slowing down at all, and it's going really fast. So we thought this is the best time to let our community members know that we are taking extreme precautionary measures for our community and our community members, as we have a lot of elders, we have a lot of sick people, like people on dialysis, people with heart disease, diabetics. We do have children that are also sick with breathing problems. So in order for us to keep our community healthy, we need to do extreme measures like doing the blockade at the entrance of our community, so that the disease does not come into our community. Because if it does, it's going to be devastating for our community members. And it is extremely important that people do not travel up to Goose Bay just to go to Teams Run or something. If people need to go to Goose Bay, they either have to pick up their medication, pick up the food, or go to the hospital. Because it has come to a point now where we're going to be at risk, as we have many of our community members being sick. We're not saying you can't leave the community, but don't leave only if you have to. We don't want the coronavirus to come into our community, because it's a dangerous virus, and it is very detrimental to the people's health that are not healthy in the first place. I would like for everyone, please, to take this into consideration. Please be safe and let our people that are sick, the elders, the children that are sick, our diabetics, and people with low immune system and dialysis, please keep our people safe. And in order for that to happen, we need the full cooperation from our community members. It has only been the last few days that we were saying we were going to meet Monday and Wednesday, but it's come to the point where we had to meet 2 or 3 times a week because of the fast growing virus that is traveling around the world. And we'd like to say to people, please, to follow whatever instructions we get from the leadership and our nurses. The other thing I'd like to mention is there will always be a nurse and a staff person at the clinic from Monday to Friday. And we have posted some phone numbers on Facebook where people who they call and who is there from Monday to Friday. But we have 2 very dedicated nurses, Karen Williams and Didi Voisey, who will be at the clinic from Monday to Friday from 8:30 to 4:30, answering questions. There are phone numbers on Facebook of where they can be reached. And also, even though the clinic is locked during the day, the doors are locked. But if you need a nurse or somebody, you need to call the Manny Ashney Health Center number, which is 497-8202. And if they need to speak to the nurse, they will be transferred to the nurse. And also the nurses that are working with us at the clinic, the public health nurses, I'd like to say that they're really up to date and up on top of everything. So if you have questions, you can call them, and they have, if they don't have the answer to your questions, they will find the answers, because we are in close working relationship with the doctors at LGH and the province. That's all I'd like to say, and that thank you very much. We will talk on the phone or speak to you on the radio again if any new developments or if anything new comes up. We'll all let you know. Please try to do what is expected of you, and try to also understand that we're doing this for the sake of our community members. Thank you very much.